I'm Dr. Quynh Kieu, and I've worked in the community for over 45 years. I've been in pediatrics, and I recognize many of my friends in this room. And I'm here at the Người Việt News, and Người Việt News is the oldest Vietnamese language media here. And I remember when it started in Little Saigon area. I'm here to speak for the children, and in a little bit I will ask for your permission to say a few words in my own language, in Vietnamese, to give the appeal. So I take care of children from the minute they're born. Well, 40% of the mothers in California depend on the Medicaid services. Without Medicaid, we would not have safe delivery. And as we speak, I know 2 hospitals in Orange County are closing the OB services and may close completely. So what you have said, even before the cuts, it's already happening. So
why is it happening before the cuts?
Because the rates of Medicaid are so low that the hospital are saying that they cannot survive and accept those rates. And then as we speak, also in North California, there are in the rural area, maternity hospitals which are closing as well. So there was several cases in which the mother in Northern California had to travel many miles and almost die from bleeding because of the lack of hospitals and how far it was. So the children of California depend on Medicaid. 5 million of them do, which is a little bit over half of them. In Orange County, the Medicaid program is a Medicaid managed care managed by CalOptima. And CalOptima has 1 million patients and is serving the children, most of the children of Orange County. I take care of them, and I've been in the community for a long time. The services for preventive care to keep our children healthy, the ones on Medicaid, are really essential because it checks the vision, it checks them for anemia, it makes sure that they grow well, it checks for the hearing, and everything that it takes for a child to stay healthy.
And teeth.
And the teeth.
The teeth are so important. And Medi-Cal covers now dental care and mental behavioral care.
So there are services that in California are expanded. So Medicaid in California versus compared to other states have a larger spectrum of care and provide, like Sandy was reminding me, for the mental health services. We all know how crucial it is, and we know, for example, in Orange County, the typical person, the typical teen who commits suicide is an Asian, 15-year-old, most likely Vietnamese, because Vietnamese represent over 30% of the population of this county, and the largest fraction of Asians in Orange County. So regarding the services for the children, California has a very unique system called the California Children's Services, and it takes care of children who are born premature or with certain problems or who have disabilities. And it does a very, very comprehensive job, as you know, because the children need a lot of services, whether they cannot hear or whether they're born several months premature. So all these services, I'm sure that you all know of, if not within your family, you know of other families and friends who have children with autism, who have children with developmental delay, who are late in talking, and it is really essential for these children to receive the services, to be diagnosed early, and to be receiving the intervention as needed. And those interventions don't stop there. It continues with education. Many people don't realize that some of the educational interventions at the schools for children with handicap are covered by Medicaid. This is very important. Without Medicaid, all that goes away. If you have a disability, if you're not If you need speech therapy or any type of therapy, or you need your wheelchair, that's gone too. And that's for all ages. Many of those families need in-home services in which a relative or someone can go to the home and take care of them. That's covered by Medicaid. All those services, which are very extensive, are covered.
Just, sorry to interrupt.
We are told by
Through the pandemic, the rates of mental health issues have risen to the highest possible. It used to be 15%, but now it's almost double, 25%, we can safely say. So as a result of that, the state of California has intensified, has provided and put a lot of funding at the schools so that the children can and the teens can have access to counseling there. But that still is not enough. Can you imagine that, for example, we need one counselor for 500 children, and we don't have that number even. So then now there are facilities in which that they attempt to provide it by telehealth, for example. So there is myriads of instances that our children are being threatened every day because of those issues in mental health and depression, and we don't have enough providers.
And what, as a frontline healthcare provider, doctor, what are you most worried about in terms of the medical professionals you work with? Do you think people are going to be laid off? Not just there won't be money to hire more people, but you're going to lose staff, your colleagues.
Absolutely. We have seen the facilities closing and the access to the facilities. I mentioned 2 hospitals which are closing now, and there are more other hospitals which are going to be threatened. We are seeing that the offices or the outpatient facilities will not have enough overhead to cover the cost. And for example, the pediatricians are always the most affected because the children depend so much more on Medicaid. Usually for an internist, it may be 25% because they see a lot of Medicare patients, the elderly, but for the pediatricians is 35% on Medicaid.
Really?
And many of the offices in Orange County who serve especially the immigrants and the Vietnamese and the ethnic minorities or the ethnic groups are even have a larger amount.
Okay.